Now, basically, lazy eye or amblyopia develops because the brain stops uh, getting connection or signals from one particular eye, or rather, the brain kind of rejects one eye. We have something called neuroplasticity with which we're working, and today we say that at any age you can treat. So we usually say you cannot treat it after you're dead. So till the time you're alive, it can be treated.
So, I was diagnosed with amblyopia at the age of 6. When you shut one eye, the world is blur, and then when you shut the other eye, the world is clear. So, how it was actually noticed was I was watching TV, and my mom thought I had a squint because when I would watch TV, I would focus with my good eye.
Hello and welcome to Little Eyes Big Future podcast. Hosted by Optometry Confederation of India, and I'm your host Rohit. So today's episode is quite special one because we are talking about amblyopia, which is also called as an lazy eye. And to have this conversation, we have with us a very special guest, Dr. Aditya Goyal, who is heading the Sankara College of Optometry, specializes in binocular vision and anomalies and vision therapy as well. He is also the president of Association of Schools and Colleges of Optometry, that is ASCO India. And our star today, Sia Jain. So I welcome you all on the show.
Thank you so much.
Great to have you here, and would like to start with Sia. So Sia, would love to know more about you and what you do enjoy doing, and what inspired you to be part of this podcast and share your experience today.
Okay, so I'm Sia Jain, and I'm a grade 11 student from Vidyaship Academy. And what inspired me to be a part of today's podcast is something that I personally went through, which was amblyopia. So I was diagnosed with amblyopia at the age of 6. And it was a condition where I thought I would see the world very normally. You know, when you shut one eye, the world is blur. And then when you shut the other eye, the world is clear. So as a 6-year-old kid, I saw the world very differently as compared to everyone else. Um, I think what uh, made me realize was when I would watch the TV or when I would see the board in class, I would sort of tilt my face toward the left. So I would only view the board with my right eye because my left eye was weak. So it was lazy. I'm here today to spread awareness and maybe help build a conversation on how we can prevent this condition from occurring in other kids as well.
Great to know that. And to dive deeper into this, would like to know from Aditya what is exactly the lazy eye thing and how does amblyopia develop in the first place?
Well, lazy eye in layman's language and amblyopia in technical language. Now, basically, lazy eye or amblyopia develops because the brain stops uh, getting connection or signals from one particular eye, or rather, the brain kind of rejects one eye. There are basically two reasons. One is strabismus or squint, and the second one is high power in one eye and less power or no power in the other eye. So usually we call it anisometropia, where one eye has high power and the other eye has no or very low power. So what happens is the brain is not able to fuse the two images. So one eye is seeing big and the other eye is seeing small, and the brain is unable to fuse the two images. So one of the image which is not very clear is rejected by the brain. And in the case of squint, the person sees double. So the brain does not want you to see double because that's going to lead you into accidents and things like that. So brain starts rejecting the eye which is squinting. So there are multiple reasons, but then the most important reasons are these. Basically, it's an adaptive mechanism of the brain, if I'm not going too technical, where we always say the function of the brain is for survival. Brain wants you to survive. And for survival, it is an adaptive mechanism where it rejects the eye which is not giving a proper signal to the brain.
Right. So are the conditions same or are they different with respect to the lazy eye and with the
Well,
squint?
they are different, and you can also have both the things together. So
Okay.
there
So
can be
how they
people
are
who have
different?
a squint as well as the power.
Okay. So what are the basically those conditions that we can understand if so that people are more aware about it, like how to detect?
Well, they need to undergo a regular eye exam. That's why uh,
Okay.
definitely we say that a child at the age of 6 months, obviously at the time of birth, then 6 months, then 1 year, and then every year of schooling should undergo eye exam. And when I say eye exam,
Okay.
it's not just the power or the visual acuity when we say the check of that. So people just close one eye, check the amount they can see, close the other eye, and that's about it. That does not suffice. You have to have a comprehensive eye exam, and that does the trick. Now, yeah,
That is very common
I'm
thing. Yeah.
sure she would not have undergone an eye exam until the age of 6, and see, this does not happen all of a sudden. If it happens overnight, you'll
Okay.
be able to realize that there was a change. But then it's right from the beginning. So you do not realize that there's a difference, and you continue and you think that everyone else sees the same. So that's the main
Yeah.
problem.
That is
So
true.
I don't think there's any other way in which we can do it. But the most important thing is they have an eye exam, a comprehensive eye exam. I tell you one very interesting thing if you have a couple of minutes. Uh, to increase the awareness of this particular problem, it's not that we have this problem in India alone, even in big countries like US, this was a problem because a lot of people are not aware of it. To increase the awareness, what they did was the first 3D movie when it came out in the theaters after. So what they did was the association, they had a questionnaire after the people came out of the theater, asking them how many of them could see in 3D. And there's a huge number of people who were driven to the clinics because they were not able to see 3D. So the main problem that happens in this is the 3D vision or the stereo vision, what we call, that is not there.
Right. Good to know that as well because that is the most missed out thing that people or the parents ignore. So how common is this amblyopia thing and like among the children, and why do many parents not notice it early? Like what's the real cause behind it? Like as you really said before that uh, you feel that everyone is having the same kind of a vision and then you don't get to that particular thing. So how common is that?
If you want me to tell you technically, the prevalence is about 2 to 5%. So if there are 100 people,
Okay.
about 2 to 5 people will have amblyopia. And that, according to me, is quite huge.
Oh,
So,
that's something that we
yeah.
have to take care
So you
about it.
have about 5 people out of 100 who are not having stereo vision. And the worst thing that can happen is,
Right.
God forbid, something happens to the better eye. Then
All
you have
right.
no recourse to it.
Yeah, great. And see, when did you first realize something was not right with your vision? Because was there any moment where do you notice things look different from one eye compared to the other?
So I always noticed that would see blur from one eye and normally from the other. But I remember just thinking, this is very normal. And I remember as a kid, I would ask my mom about the tear ducts in my eyes. And I used to be like, oh, I have holes in my eyes. Why do I have holes in my eyes? And my mom was like, oh, no, that's normal. Those are your tear ducts. So I would assume that, even something like this is very normal. So that was my whole childhood. And then I never really told my mom that I wasn't very like clearly able to see in school and everything because obviously one eye was perfect. So I would shut one eye and I would see the board or see TV with that one eye. So how it was actually noticed was I was watching TV and my mom thought I had a squint because when I would watch TV, I would focus with my good
Oh,
eye. So eventually, she was like, okay, we'll go check your squint out. And then we went to the eye doctor when I was, I think, just turning 6. I was 5. and I had -5 power in one eye and no power in the other. And it was like, it came as a shock, obviously, because that's a lot of power. And then that's how it kind of started. And I was also, in my lazy eye, I had a vision of 6 by 18. And I was told by the doctor 6 by 6 was a vision I couldn't achieve because I was getting close to the age where it would get really tough for me to sort of fix this condition. And yeah, I think over the course of 2 years, I started doing eye exercises like a lot. So it was like 2 times a day, and I would do things like doing the pendulum and sort of training my eye because as Dr. Aditya said, it's basically your brain is um, trained itself to only focus on one eye, right? So your weak eye is not trained. So I spent 2 years sort of training that eye, and there's uh, there's something you do which is patching. So you patch your good eye, and you train your weak eye. And over the course of 2 years, I was able to achieve a 6 by 6 vision as well.
Great to know that. And Aditya, doctor, would you like to share something on the concept of tear ducts and all? Because then we'll be
No,
able to understand
it's
how
got
to
nothing to do
understand.
with
Okay.
amblyopia lazy. So you have these tear ducts,
Okay.
I mean, the holes out here which drain the tears out of your eyes, go to the nose and throat, and
Okay. So is it a common recurrence if you're having the amblyopia, you'll be having those tears on a regular basis or something that like that happens?
it's got nothing to do with tearing as such. I mean, you're strained, so you may
Okay.
tear, but then there's no specific correlation between the two. So they are
Okay.
as normal as you and me or her at this point of time. And the problem with this is so chronic, so you don't realize that you have a problem. So it's just that you feel that everyone sees the same way. So
Yeah.
they don't realize at all.
Right.
And
Yeah.
one thing which can be corrected, which can be treated with no recurrence, with nothing, very simple treatments. I it beats me why we have this much of prevalence and still, I mean, prevalence is okay. You can be born with these problems, but they can be definitely taken care of. We do not want anyone to be amblyopic and
Yeah. That is something that we are
yeah.
working on. And through these conversations, people get more awareness and they get educated. So, anything happens like with the early diagnosis, like does it really make a big difference in
Well,
treating
yes,
that?
early diagnosis and early finding it definitely has a better prognosis. But like what she had been told that nothing can be done after a particular age, that's a non acceptable concept today. A lot of people still say so, but then with the advent of newer ideas and newer thought processes, we have something called neuroplasticity with which we're working. And today we say that at any age you can treat. So we usually say
Okay.
you cannot treat it after you're dead. So till the time you're alive, it can be treated.
So the mode of treatment differs for the people at the young age and people who are
Not
adult
really,
and
it's
growing
practically a
accordingly.
similar kind of treatment. Only thing, the multimodal modalities are used, which is, we call it vision therapy. She called it exercise. Okay, in a way, it is exercise. So we are training the brain. We are not training the eyes. We train the brain to accept it. So basic issue is the brain is not accepting it. So we provide a feedback to the brain. So let's say she's seeing double. Okay. Now, the
Yeah.
feedback to the brain is double, right? And
Mm-hmm.
now that you know that you're seeing double, you can make it single. So we provide the target with which she is seeing double and make it single. Now she has the impetus to make it single. But if she does not know that she is seeing
Okay.
double, how will she ever make it single? Or one eye is blur, other eye is clear. If you do not show the blur, then how can you make it clear? Right?
All
So
right.
that's a very simple thing that we use. And that's called vision therapy. We use the top-down approach where we train the brain, and ultimately everything is fine. And I'm sure I do not know what her stereo vision is, which is the stereo acuity. But then we work towards stereo acuity rather than visual acuity. Visual acuity is what she was talking of, 618, 6.6. She has attained 6.6, fantastic. But then, even if you do not attain 6.6, my aim is always towards attaining depth perception, the 3D vision. So once you attain 3D vision, then nothing can happen.
Okay. And how long it will take to attain that particular vision once this is achieved?
Difficult question to answer because it varies from person to person. Luckily for her, she had only 618, which is considerably good visual acuity. But then we deal with patients who have 1 by 60, where you're not able to see even your palm, that kind of thing, and then treat them. So take them from there to decent good vision. So it depends upon the kind of problem that you have. I don't think I'll take about 2 years to get a 618 to 6.6. Today's methods are very different. Uh, Maybe 618 to 6.6, probably about 3 months.
Yeah,
Wow.
And
that's great.
like,
CIS therapy.
doesn't matter, it's okay. It's good to exercise.
See, I want to say something.
It was really, obviously it was a really taxing process. I think the technology now would have improved, but so when I was doing it, I had to do a pendulum. So we would have a pendulum attached to the wall, and I'd have to follow the pendulum 30, 40 times. And then we'd have exercises where there would be a ball. So I would throw the ball from one hand to the other hand and I have to observe the ball. So, I mean, when you're six, obviously it's like the worst thing in the world where it's like, oh my God, I have to sit and I have to like exercise my eyes now. I have enough physical exercise now. I exercise also. But so obviously it was a taxing process as a kid to patch and come back from school after an 8 hour day and patch for 6 hours. So obviously it was at obviously now I'm sure I would love to learn from you what we do now. But like what now 10 years ago, it
Yeah.
was obviously very
So
different. And I had to do a lot of
going by the
extensive
experiences of the
work.
patients, I know it becomes very cumbersome, very difficult for us to get them motivated to do for a long time. So what we have started doing is making it a lot of fun. So we have introduced a lot of
Yeah.
games into it, and basically you're playing a game and then convert it into an exercise format or things like that. And we do not patch anymore. There are people who are patching, but then uh, invariably we do not patch. So the social stigma of patching goes off. A lot of amblyopes have problem with patching. It's a social stigma. So you don't want your eye to be patched and moving around on the roads or schools especially, because this happens in kids, starts with a young age invariably, and as a you go to the school with a patch on the eye, you know how the your peers are going to treat you. So considering all that, now the patching is kind of gone. We don't patch it all the time, only during the therapy if at all, and that to a translucent patch. So things have changed, but then, yeah,
Yeah. Yeah, I mean, I myself am currently working on a project where I'm building an AI curriculum on amblyopia. So all these exercises, I'm working with an IIT professor to sort of develop and research more on the condition because clearly I'm not completely well versed as well. So I'm working on it and I'm currently working on even just building a basic curriculum to obviously make it more engaging and fun for kids because I knew how hard it
I
was
know.
growing up.
So we have VR-based games, so you play the game and it's very interesting. So things are becoming more and more interesting.
Yeah.
But then, yeah, basically the principles remain the same. We are making it game-based. That's all we are doing.
Yeah.
It's good thing like the changes are coming, the advancement is happening, and the patients or the people who are diagnosed with amblyopia getting better treatment. So that is the welcome change that we are able to see, and people like you who are educating, spreading awareness. So it makes easier in a way. So, would like to know, are there any early warning signs that parents or either teachers can look out for? Because ultimately they are the one who is going to notice that kind of a
I
thing.
would say squint. If you see a
Okay.
misalignment of the eyes, do not take it because a lot of societies in India consider it as good luck. There's no good luck in that. So if you see
Okay.
squint, it's 100% warning sign that you're going to have an issue. Obviously, the power you cannot say. So parents can just about close one eye and see how your child is seeing and close the other eye. If you're seeing equal, it's perfectly fine. Otherwise, like I said, a very small eye exam does not make things very cumbersome for people. So they should undergo an eye
Yeah,
exam. I mean, amblyopia is one thing, but then there are so many other things which you can detect with a comprehensive eye exam.
definitely. And are there basic tests involved into this particular process apart from like closing one eye and then looking from the other eye
That would reveal
around
it
it?
as much. So once you have that understanding that there's an amblyopia involved, then you can do further testings which would be required. And with that, you know everything, and then you go about treating it. It's not very cumbersome, but
All
then, yeah, one visit is required for sure.
Yeah. So this is the common way of getting it diagnosed,
That's the
right?
way. We do school screenings. So we have developed
Okay.
certain programs, softwares, etc., with which it becomes very easy. Now, what happens is when we do the screening, people do not land up at the clinic or the hospital. So we do write letters to the parents saying that your child requires, or to the teachers that the child requires a visit to the hospital or the clinic. But then most of them, they do not. They think it's a commercial activity because of which they are not coming. But then, yeah, they do go to a number of places and ultimately land up. But like you
Okay.
said, if taken care earlier, diagnosed, detected earlier, treated earlier, that's the best. More than anything else, you're losing those years of initial formation. So let's say a child till the age, like Sia for that matter, till 6 years, she did not have binocularity. Binocularity, both eyes working together. Now she has lost that much of her learning period, not the academic learning, but the overall learning period. She has lost that. Now that cannot be recovered.
Yeah.
She has recovered her visual acuity, probably stereo acuity, probably everything. But who will recover those 6 years of her life?
Yeah.
That learning period is lost. That's the reason why we say earlier the better. So if you're diagnosed at the age of 1 year,
Absolutely.
6 months, fantastic. You do not lose that time.
Right. So is there any connection between learning things and having this amblyopia, or like is it
Huge,
interconnected with respect to any of
huge.
the brain thing?
Absolutely. So academic learning as well as
So
the play, you'll not be able to catch a ball,
Yeah.
okay? Because you do not have,
I mean, obviously, right?
yeah, go ahead, Sia.
If you're not able to see from one eye, you're constantly anxious about the fact that you're not able to see. So you're not actually able to learn much because you're constantly trying to sort of figure out how to be able to even see what's going on before you're able to absorb any information.
So even in play, so if you're playing cricket or shuttle or table tennis or anything, you'll not be able to connect. You just have to learn over a period of time that the ball is coming that way and you have to hit it that way. But then it takes a huge long time for that adaptation to happen. But then if you have depth perception, climbing down the stairs becomes a pain. So you have to learn, you have to adapt to it. Why should a person adapt to that when it is so simple to get rid of it or treat it?
Great insights on that. And see, before the diagnosis, what was your world like when you saw the blurred with one eye? What did it mean to you in your daily life? Because as Dr. Aditya was telling, like it really impacts a lot of areas of your life into the early stages. So would love to know from that particular experience.
Okay, so I mean, obviously, I don't remember when I was like really young, but I think I started noticing it when I was having trouble in school, but it wasn't like I was able to hear, but visually, I was very confused on what was going on, whether it was on the monitor or on the board. So I would spend 30, 40 minutes of the class just like sort of covering the eye and copying the board. I didn't actually get to the learning part of things. Or whether it was TV or movies. As you said, you can't see a 3D movie. I couldn't see 3D movies. So it was too blurry and I wasn't able to figure out what was going on. And I think it started, obviously, as you mentioned again, it prevailed when my mom noticed I had sort of a squint. uh, the moment you have a squint, it's the sign of a lazy eye. So eventually, that's how we got to fixing it. But I think something even as basic as I couldn't read boards or signs, and my parents would ask me, and I would constantly avoid the question because I didn't sort of want to seem like I didn't know. So it was something that obviously developed subconsciously in you. Uh, that you know you're sort of slow in learning, but I think once I was diagnosed with it, things got easier and I got my specs, and obviously things with time developed and I was able to sort of get um, in touch with what was going on. But obviously as a kid you're very confused because you're like, what's going on? I don't know, I'm not able to see, I'm not able to understand. So it's a mentally taxing process inevitably, which is why I'm so like sort of I want to spread awareness on it because at least I got to it at the age of 6. There's a lot of people
Yeah.
who don't know it till they're really old. So I mean that's the
Yeah.
aim.
Pretty much a thing that now that Dr. Aditya has given us the assurance, like it can be treated in any of the way
Yeah,
or the any
definitely.
age. So that is something that we can be assured of.
One thing I want to add over here, we're only talking from perspective of eye, calling it lazy eye.
Yeah.
Yeah.
Now, when we talk about it as professionals, we do not call it a person with a lazy eye. We call it a person with amblyopia. The eye with amblyopia, we call it a person with amblyopia because it's not the eye alone. Because you see, if one part of the thing is not functioning well, the rest of it, the entire body, your focusing mechanism, because everything is bilateral, you're dividing that entire body into two halves. So the way you use that part of the body which has the eye which has amblyopia, the entire thing, the bilateral integration, the other issues, the focusing, the like she was saying, she was asked to, why was she asked to do the ball rolling that way or the other way? Because the entire bilateral, we have to use both the parts of the body, both the sides of the body. So that has to be activated. So we call a person with amblyopia rather than eye with amblyopia. So it's not the eye alone that we work on. We work on the entire system. So
Yeah.
it could be that one leg is moving faster as compared to the other. It could be one hand is acting more as compared to the other. So a lot of things happen with amblyopia. It's not eye alone. And like I said, it's a neural thing. So neural affects everything. And eye uh, takes care of about 80% of the actions that we do in our day-to-day lives. So it's a huge thing.
So you mean to say that we have to follow this inclusive approach when you are
100%,
diagnosed with
100%.
such things?
Diagnose as well as treat.
Oh, that is
That,
very much of importance. Because and treatment differs for each and every individual as per the cases, like each and every
uh,
case.
considerably similar. I won't say same, but
Okay.
considerably similar.
So, if I have to understand this in a bit detail, what are the differences between the diagnosis? Like, so I am with amblyopia. The other person is also with the amblyopia. So, what are the differentiating factors you can find between two people?
Nothing much. So the cause for amblyopia is the first thing. You cannot have amblyopia with no cause. Okay. So there has to be a cause. So like I said, the two main causes are, one is the difference in power in the two eyes, which is considerably huge. Like Sia had -5 in one eye and nothing on the other. So that would not give the proper image to the brain. Second thing, like I said, is the squint. So both the anisometropia, which is the power part, and the squint, they have a different way of treating. So the diagnosis would be very different, and treatment would be very different. Now, in her case, like she mentioned, her mother noticed she had started squinting. So the power led to squinting, and that led more and more. And good that she was diagnosed at the age of 6 years, where it was 18. Quite certain, had she not been diagnosed today, her visual acuity might have been 624, 636, even worse.
So, yeah. And is it anywhere related to genetics, or there are other eye condition that forms usually over the period of time after the
Well,
birth?
yeah, genetics in the sense like power definitely has a genetic influence. Squint also to quite an extent has that. So it is possible. So it's not amblyopia which is transmitted, but then the power, yes, if you develop that power in one eye and no power in the other eye, you can land up with it. If you develop a squint in one eye, you can land up with it.
All right. And Dr. Aditya, is there a kind of like what type of consistency is required? Because as you said, like it can be cured at any stage, but the treatment has to be followed with certain rules and regulations as well. Because you are treating a person, you won't be able to see the change happening in a days or like a month. So, why does consistency matters in treatment, and what do you tell the parents
See,
as well?
something like you go to the gym one day and don't go for 1 year. As simple as that. So I don't study for my exams through the semester, and I mean, don't study at all and just start preparing on the last day. So consistency does matter, and that is required.
Yeah.
Yeah, I mean, I did it 2 times a day for 2 years. So it's a lot of effort, it's a lot of time. But I mean, obviously now there's better technology and you can fix it within 3 months. But back in the day, we used to like, it was so much time and it was an hour each time because there were so many exercises and you had to, it was very repetitive because you had to do one thing so many times. So whether it was throwing the ball or the pendulum, we had candle reading, and then I'd have to cover one eye in color. So that's a lot related to the games, obviously. Um, and I so obviously a doctor would always like make it engaging because I was just a kid. So I was told, I think one of the parts I loved about patching as a kid was I was told to cover one eye and make slime. And that was an excuse for me to just mess up my house all the time. But I think the more engaging it is, obviously a kid is also consistent with it.
Right. And these days, like the childrens have got a lot of tantrums to throw. So
Yeah.
we have to deal with that as well because in our age, like me being millennial, we didn't have a exposure to a lot of things, but these days it's quite a different thing. And how much time one should allot to this particular treatment or the exercises that uh, are being recommended?
See, I am talking in terms of about half an hour to 45 minutes every alternate days or once in 3 days, something like that. And that should suffice more often. And now with technology improving and thanks to COVID, we developed something called supervised online therapies. So you do not have to come to the clinic.
Hmm.
So you connect to the patient online, like what we are doing now, and I do the therapy on. So they're doing it at home, and like what she would have undergone is go to the clinic every day, 2 times, and all those things. So all that is not, if they can come to the clinic, nothing like it. But then if they cannot, so the distances have lost the significance. So we treat patients across the world. Only thing, if I'm treating a person in US, I have to wake up at their time. They are not going to remain awake during my times. So that does matter. But then apart from that, we can treat anywhere. Most patients we are able to treat.
All right.
I mean, I
I
would
need to,
love to be a part of like the vision therapy once, I think, at least so I could learn more about
I
what's
would,
going on
uh, I'd love
today
to
as well.
get you over to the hospital over here, and then you see our VT clinic and things that have changed. And yeah, and
Definitely.
your experience will make a lot of difference to the kids and the adults who are undergoing therapies. So we do almost about 60 odd sessions a day,
Oh,
and
wow.
approximately about 20 odd online. So we do considerable amount of it,
Online.
but then, yeah, and our hospital, we have about 14 uh, branches across India. So every hospital of ours, we have introduced vision therapy, and we are doing considerable amount of it.
so
Definitely.
is it for the special cases or like a normal person can also be
Anyone
part
can be
of
a part
this?
of it. Till the time you're interested, you're most welcome.
Great. Would love to be part of that as well.
Join join the.
Yeah. And to understand in a deep, like if you are taking a personal use case or like if you are taking a particular person who is diagnosed with amblyopia, so they aren't taking any treatment, they are diagnosed with it, they are having the spectacle, they have been using it. What happens if they don't take the treatment? Like how it impacts in the later part of
Well, they
life?
are one-eyed persons, one-eyed giants. So, like I said, no stereo vision, no 3D vision, and that affects your
Okay.
functioning, your profession. So, suppose you want to enter a profession which requires stereo acuity, depth perception, you're out of it. A lot of professions, you're just out. Uh, Functionally, also, for example, if I'm doing a surgery, I'll not be able to do surgery about, with no stereo acuity. A lot of problems happen. So we take it very easy. We think, okay, सिर्फ स्टीरियो एक्विटी तो नहीं है ना और सब कुछ है. I'm able to see. Seeing is not what I'm talking of. It's
Hmm.
the stereo equity, the 3D vision, which is the most important thing. That makes you understand that the brain is using both the sides. And like I said, it's a person with amblyopia, so everything else is impacted.
Right. So it's better to understand the approach we should be having towards it so that it gets easier a bit, so that you can treat it early, get a clearer vision, and then things get better for yourself. Because then we don't regret on a later
Absolutely,
point of time.
absolutely.
Yeah.
Then, I would
And
definitely
it's
say
the
that a lot of people still say that it cannot be treated after 10 years of age. No truth in that. Obviously, better to treat it earlier the better, but then no truth in that we cannot treat it after 10 years. So we've been treating people who are 50s, 60s also.
my God.
So
Wow.
a friend of mine from school, he is 62 now, and I treated him when he was 52 or 53. So we can treat that. Yeah, the prognosis, the amount we are going to achieve, that may be a little less. The time required may be more, but then it is not that it cannot be treated.
But that's fine. Like it just enhances your quality of life or the way you look at the things, and then you build that particular confidence. You can guide that other person as well about the possibilities that are
Yeah.
happening into this particular area of the thing, the sector, and then it gives you more kind of a privilege as well. Like, oh, you can treat that particular person at
See,
this
they
particular age.
realize, and like Sia had that at the age of 6 years. And she realized at the age of 6 years. So that time she will not understand the magnitude of issues that are going to happen in her life. But and like
Definitely.
she found it cumbersome, a person who is 20s, 30s, When he realizes that these are the issues, they are more conducive to the treatment. They don't mind undergoing because they are seeing what is coming.
Yeah. Good to understand that part as well. And see, like when you began your treatment, you were telling about your experience as well. Like, did it feel strange or was it challenging or was it fun kind of a thing for you?
So initially it was strange, obviously, because I was told to throw a ball around and follow it with my eyes. So initially, obviously, I was very confused, and I'd already been patching for I think 6 months, and then after that, I was told that I have to do these exercises, which honestly I thought was just like another one of those, Ayurvedic medicines that your mom comes up with. That's like, oh my God, it's gonna sort all your problems, and I was like, oh my God. But I think the more I did it, obviously, it became habit, right? So the more you do it, it becomes less cumbersome. Obviously, it's not something you want to necessarily do, but over the course of 2 years, 2 hours a day, I was sort of very invested in it. It became a part of my routine, a part of my day. But it's really nice to hear that there are so many more treatments now and we can be treated at any age. I mean, I wish I had that liberty where I could figure it out within a span of 3 months. Uh, but yeah, I mean, it
Yeah,
does take a lot of effort, a lot of time. Mentally, it's really strange because you're a kid, right? You're not able to really comprehend what's happening, which is tough. So, yeah. But I mean, when I went and I actually ended up achieving the vision I wanted to achieve, I think that was such a relief and it felt like an achievement. And I was like, okay, thank you. This wasn't just another Ayurvedic medicine. But yeah.
any words on it, Dr. Aditya?
I don't think Ayurveda is that bad. But then,
I mean, the
I mean, just
generation.
joking about it. But then, yeah, vision therapy,
Yeah,
yes, it works. And a number of times what happens is the children get so used to it and they say, okay, fine, I don't want to stop it, I want to continue. So we usually don't stop it. It is something like we cut it down. So maybe I'm doing it every day, then make it once in 4 days, 3 days, cut it down and keep tapering it. And we call it, we want a person to continue doing it to an extent, like not fully. Now she is perfectly okay, but then once in a month, once in 2 months, if she does that, just to check if everything is fine, nothing more than that. Or just go for a check once in 6 months and see everything's okay. So if everything's fine, well and good. But if something is missing, rectify it.
perfect. And what role do parents have to play into this particular when the child is recovering from it? Like any quick
Get
tips
them to the
for it
clinic.
on
Yeah, quick. So now
how
we
regularly?
we do have certain, you know, but the problem is, I say, okay, hold this at 40 centimeters and read, for example, something. Uh, the normal tendency is, okay, fine, you're not able to read it, okay, come closer and see, and then the person will be able to see at 10 centimeters. And they said, no, 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 he's able to read. It's not the reading which is the criteria, but at 40 centimeters, they should be reading it or seeing stereo. So, more than anything else, there's a kind of denial among parents that my child cannot have it. So, that
Hmm.
denial is something which is to be overcome. So, it can be through, we have to demonstrate that, yeah, your child has an issue. And it's nothing like which cannot be taken care of. We do take care of it. But then you have to understand, you have to accept that there's an issue. Denial has to be overcome. And once that is done, then we take care. And like I said, there are different modalities available today. So you do not have to come to the clinic. You don't have to come to the hospital every day. We can do it online. We could do a number of things which are very, very easy.
I mean, a
Right.
big part of why I wanted to like come on here and speak about it today as well was, I think in India, preventive measures are not uh, sort of used very commonly, right? So anywhere else, maybe you get yearly checkups, whether it's for your eyes or your just general full body checkup. And I think it's not common here in India. So a lot of the work that I've been working on for the past since I was in grade 9 was sort of hosting eye camps in school and in government schools, because obviously, right, until you know there's an issue, you can't fix it. So I think the most important thing that needs to be worked on currently is definitely the prevention bit of it, because a prevention is always better than a cure. And I think
Right.
that needs to be worked on in society in general.
The best thing that can be done is a routine eye check right from the time you're born.
Yeah.
And it's not going to take time. The
Definitely.
eye checks at the birth or 6 months or 1 year, they're very, very short. It hardly takes maybe 4 or 5 minutes to do the entire thing. So I think we can afford that much of time.
Yeah.
Definitely. And that's the most ignored part that we see usually. And then we like come to the conclusion, oh, this is something that they are diagnosed with, and then you have to treat. So early diagnosis can save a lot of time and effort as well between the two parties involved. So yeah. And can it happen, Dr. Aditya? Like, can amblyopia come back if the treatment is stopped too early, or like if the vision is clear now and then it can suddenly can
Yeah,
cause a
it can
reoccurrence?
happen provided there was no stereo acuity involved. That's the reason why I'm insisting on stereo acuity all this while. Stereo is 3D vision. Once you have that 3D vision, then very, very rare for it to regress. But then, if you have just improved the visual acuity, like what she was talking of 6, 6, 6, 18, if you have just improved that and the stereo acuity has not improved, then yes, there can be an issue. There can be regression. So you achieve 6, 6 and then you go back. It can happen. But then if the stereo equity has been achieved and it is to a good level, very, very rare then anything can happen unless there's another event or something.
Thank you so much for sharing those insights, Dr. Aditya. And Sia, it has been great interacting with you, knowing your first-hand experience about it, and then Dr. Aditya guiding us like how it has to be and how it can be done. So it gives us a lot of areas where we can improve, where we can understand how things should be and in what way we should be proceeding ahead with respect to the lazy eye thing. And I'm sure that it's not just about the lazy eye, but it's more about the awareness and the education that gets spread through this conversation, and it will help many out there. So thank you so much for giving me this opportunity to host you all, and it has been a pleasure.